So in the end, the more important thing about history of presenting illness, when you take the history like that, other than follow your template of history taking. I know as medical student, everybody has template for history taking. Cough, ask this. Okay. Fever, you need to ask this. Pain, you ask what? Your Socrates lah kan. Severe onset. C, character. R, radiation. T, timing. E, any exacerbation. S, severity, or don't know lah, whatever relieving factor on all this lah. Template, you, of course you follow your template. You still want to get all those things. But in the end, more important thing, if patient don't have underlying disease like this patient that you presented, kalau patient you don't know your diagnosis, you still have to think about your differential. When you think about your differential, certain diagnosis will have certain history you want to take. For example, fever. Okay, kalau fever, you ask about this, your template of fever history. The next thing you want to know lah, fever because of what? Is it dengue? So dengue history, you ask specific thing. Dengue specific thing, headache, retroorbital pain, any PTK, bleeding tendencies, any joint pain, any abdominal pain. Okay, those are specific dengue history. Then kalau plus dengue, any recent dengue or not in nearby neighborhood, maybe like it falls under social, but I still want to be under your HOPI. True or not? Because you are trying to take history to come up with a diagnosis. Travel history, any recent fogging. Then kalau fever plus, you want to know, is it leptospirosis, any recent swimming in the river, in the Tasik, any recent picnic dekat air terjun yang kotor-kotor somewhere, is it house infested with the rats or not? Okay lah, any go playing dekat longkang or somewhere lah. Alright, that's specific history lah. Any history of suspect typhoid ke apa ke, rashes plus diarrhea plus any eating outside and all that lah. Those are basically certain example. Kalau malaria, pergi travel ke hutan lah, water activity, pergi masuk hutan and all that, then suspect lah malaria. Okay, you pergi western country, Europe country, US, probably suspect even penyakit pelik-pelik lah. Macam hari tu I bagi lecture Lyme disease, sakit sendi and all that, joint lah. Okay, those are basically you take your basic, your usual history. After you finish your history, you think about diagnosis based on the presenting complaint. Okay, so your differential for your patient yang datang dengan cough, fever, rapid breathing, on top of your, it could be just acute exacerbation, you have to think about other thing. Is it TB or not? So for TB, what history you want to take? Seek contact lah, paling penting. Any contact with TB patient or patient with chronic cough. Sometimes patient undiagnosed, but patient duduk batuk. Okay, ni weight loss appetite, night sweat. Those are typical TB lah, but in children, they don't present with typical, they present with very poor weight gain. They present with chronic diarrhea as well. And then patient rumah very crowded. Okay,
I know that.
Chronic cough, they can have diarrhea as well lah, but the weight loss, the chronic cough is more important symptom lah. And in the end, very poor weight gain. If poor weight gain, you have to think about TB juga. Okay, especially kalau ada contact. And rumah tu very crowded area lagi lah, more likely for them to have this diagnosis lah. Okay, that's just about history taking lah. I always tell students about how you want to take history in pediatric lah, and the extra details for each of component, because you follow for template macam tu, you don't get the exact history that we want. Okay, so in the end, always think about differential. When you take your the chief complaint tu, formulate in your mind already what could be the diagnosis straight away, then you can take very specific history. Okay, kalau dekat ward tu, is it either pneumonia, bronchiolitis, asthma, TB? Itu jelalang problem yang possible. Kalau cough more than 2 weeks, you have to think about asthma and TB already. Cough 1 week, 2 weeks, think lah pneumonia, bronchiolitis, depend on the age. Datang dengan fever, joint pain, think lah dengue, rheumatic fever, HSP. Okay lah, and then JIA also lah. JIA will probably down the list lah.
JIA master. the arthritis must more than 2 joints.
Can be a single joint also.
Can be single joint.
Can be. Oligoarthritis less than 4, so one also still qualify.
Oh, okay.
Okay.
Because at least I saw some classification criteria at least 2 joints.
At least 2 joints lah, but it's even single joint kalau ada deformity, got arthritis punya sign, could be JIA also. Because rheumatic heart disease, rheumatic fever, they just joint pain. Arthralgia, not much arthritis. True or not? Okay. Alright. Those are basically the tips on how you take history. Apa lagi common presenting complaint kat ward? Seizures. Sawan. Febrile, no febrile. Febrile seizures, differential. Febrile fit, 1. Meningitis, 2nd. Apa lagi you want to think about?
Electrolyte
prevalent don't come with fever. So fever tu you have to think about more severe disease lah, like is it acute demyelinating encephalopathy, acute necrotizing encephalopathy, meningo encephalitis, those things lah. Autoimmune may have fever, may not have fever. Okay, but febrile seizures you can put autoimmune encephalitis as well lah. Okay, apa lagi datang dengan fever? Fever rapid ada dan infection related. Not much lah. Okay, meningitis because of Kawasaki also possible lah. Okay, they have some meningism juga kan. Alright, so for rapid lagi lah banyak you punya differential, electrolyte imbalance, vomiting. So every diagnosis tu in certain umur tu you have to basically come up with your own differential common one you have to rule out first. Because you focus on the common one, then you won't mistake lah, so easier for you to pass. And you think about uncommon one straight away, forget about the common one. Macam how macam mana nak pass kan? Cannot pass one lah. Okay. Already your first statement is patient got underlying chronic suppurative lung disease. Okay, then I would like to know further lah about this current illness, whether this one acute exacerbation of chronic suppurative lung or not. Okay, so yeah, you go through your asthma history first. What the asthma history related history?
There is some cough during he was healthy.
Okay.
And he was on routine nebulized saline 5% and 4 times per day, and also azithromycin.
So I think part of it also is if patient has underlying problem, after you finish presenting the current presenting complaint, you need to explore a bit more on the underlying problem, because the underlying problem most likely related to the current illness. True or not? If underlying problem not related to current presenting symptoms, for example, patient got hypothyroid, and you don't have to explore on the hypothyroid first in the presenting illness. But since patient presenting with lung respiratory symptoms, patient have underlying respiratory problem, you should explore further on the underlying problem lah. So what history you want to ask regarding the chronic suppurative lung disease in this patient?
So he's diagnosed at 6 months old, and he had a history of intubation in 2017 due to a lung infection. So after that, he was on home CPAP for 3 months and came off in 2017. And currently, he was on nebulized saline and also MDI salbutamol 2 puffs prior to the nap also, and also oral antibiotic azithromycin 3 times per week.
Okay. So all the history that you get under the underlying problem tu, what else you want to know other than the information that you have given me just now?
Chronic suppurative lung. And about the admission, but because
not just admission, regarding all the plan that has been given to him, the nap saline or the azithromycin, you want to know lah, patient compliance one thing, whether patient doing it or not at home.
I didn't ask about the compliance. I think
lah.
the father is answering me very clearly, so I thought he's compliant.
Doesn't matter lah. Then you still need to ask certain thing lah, whether ubat the azithromycin they are taking regularly or not. How you want to check compliance? Basically, you ask lah, what medication? Usually the compliant ones, they know what medication they're taking. But some know the name, some maybe know this ubat is this lah. Then they know what time they're taking. If there are some hesitation, not sure, kejap answer like this, kejap answer like that, then you know lah, maybe there is probably compliance issue. But patient yang ambil ubat hari-hari, of course they will remember what time they take. Okay, alright. Then you want to know lah all the next line, the next line, the physio, are they doing it or not at home? Then if they're doing it, what time they're doing it, who doing it, all those things you ask lah. And then you know lah, the one yang very compliant one, they should know they're doing it regularly, every time, so twice a day, 3 times a day. Okay lah. Alright. Then the next thing you know lah, how frequent the infection patient has been getting lah. So
3 times in a year.
3 times in a year.
Admission.
So when was the last admission?
What's jot down?
When was the last admission? What happened during the admission? Require intubation, CPAP or not?
No intubation, only CPAP.
Okay, what was antibiotic given at that time? What was the previous culture taken at that time? What was the result? Those are the things basically that you basically need to know and get the answer, because the current presenting problem is always related to the previous punya problem or underlying problem lah. Then that's how you manage it lah, because I want to know lah, this is because of previously untreated punya culture. Sometimes the culture you want to treat because you think it's colony patient, because patient is well. So if you think that positive culture is probably colonizer, okay, and you colonizer, you don't treat lah, you biar je lah. But somehow when your patient had next infection happen, then you probably that colonizer become infective already, so you want to treat it. Okay, some parent may know, some parent may don't know. You can ask lah, you don't know, then you can check later on lah. But that just showing you your thought process lah, basically how you think about the current problem. All these things need to be still under presenting illness, because it is a current problem and related to the underlying problem lah. Past medical history, I would just put totally any other underlying problem that totally not related to the current problem. Okay? Alright. Understand or not? That's basically when you are master student already, postgrad. This is the way how you formulate things, how you arrange your thought, how you arrange your presentation. We expect that kind of presentation. We don't expect you to present like medical student already. Yeah? Medical student, you follow how you learn things lah. One by one. But as you grow older, as you grow more mature in terms of thinking, we expect certain things need to be during your presentation. Kind of like summarize it lah. Because you won't have like 15 minutes every patient. Sometimes you want to know all this thing. I cannot see every patient 10, 15, 20, 30 minutes lah. Because there's like 20, 30 patient, you know what. If not, kalau seorang half an hour, 30 dalam half an hour berapa? 8 jam, 15 jam. Right? Yeah. How to finish around 15 hours? 30 patient, one patient 1 hour, 30 hours. Half an hour, 15 hours. You work only 9 hours a day. Cannot lah. So that's why I very jittery already. All the information I cannot get. Sometimes I just get scary lah. When you are already at my seat, then you know lah. So many information you have to listen to chew. Understand? Okay. So continue.
So past medical only explore the lung lah. No other.
Okay. Alright.
So birth history is term, born well. Emergency cesarean section. I didn't ask.
Of course lah, you still have to ask the detail. At this point, there is no shortcut. You have to do it, you still have to do it. So what about birth history you want to know? Not just birth history, you want to know the antenatal history. Especially kalau your patient is the young one, the infant, the neonates. Lagi more detailed antenatal and birth history. But the bigger one, you get you ask, you don't get, then that's fine, because sometimes parents also can't remember very much lah. But the mode of delivery, they should remember. What was the birth weight, they might remember, especially just one or two child. But got 5-6 children, they might not remember the birth weight of each child lah. Okay, so antenatal history, what you want to know lah, any underlying problem lah, maternal disease lah, diabetes, hypertension, torches, infection, history of antepartum hemorrhage, history of UTI, GBS swab, any positive culture, all those things you want to know lah. Any recurrent threatened miscarriage, perlukan antibiotics, if patient on recurrent admission for pram contraction, you want to know lah, the DEXA, Metason has been given or not, twice or not. Because it already given, then you know lah, patient have lower risk of developing RDS lah if delivered prematurely, compared to those babies yang mother not given DEXA. Understand? Okay. Then peripartum punya history lah, during the delivery itself, any issue or not. Okay. Some we have no issue antenatally during intrapartum, uneventful lah. But certain history that you want to know, intrapartum got fever or not, got false smelling liquor or not, got meconium sing liquor or not. Okay. Then got any issue intrapartum boleh jadi apa lagi? Birth asphyxia lah, like shoulder dystocia. Not just shoulder dystocia, even cesarean section pun, even though cesarean section you don't have risk of shoulder dystocia, you still have risk of issue during delivering the baby. Some baby stuck dekat the insertion set to deliver the head, need forceps and all that, probably 5-10 minutes. Also that could be the issue as well. Sometimes you need to know lah. Okay, alright. Then postnatally any issue lah, masuk masa admitted where, admitted to NSU, admitted to postnatal, discharge to mother. Some may just need resuscitation or not. ABGA score berapa, that's important lah. ABGA, if they cannot tell you the number, yeah, you need to know lah, baby cry or not straight away during delivery. Then you know baby cry straight away in delivery, then given to mother, probably ABGA 9-10 lah. Standard lah, 9 at 1 minute, 10 at 5 minutes. We said 9-10, that what it means lah. At 1 minute berapa, at 10 minute berapa lah. Okay. So ABGA score. If admitted NSU, admitted for what? Is it respiratory distress? Is it for ventilation? Is it for, or not just NSU, some may have neonate ward, like special care nursery lah, SCN. SCN probably is not ICU, not an ICU. Ada ward like that lah. Some admitted for hypoglycemia for monitoring lah, because infant are diabetic mother. Some admitted because of cooling therapy. Cooling therapy for what? Cooling therapy for what? Hypoxic ischemic encephalopathy lah, neonatal encephalopathy. We don't call HIE anymore lah, we call neonatal encephalopathy. Then admitted apa lagi reason for admission? Ada ventilation, cooling therapy, yalah, infant of diabetic mother, infant of cardiac, issue of antenatal diagnosis for cardiac problem also can. Mother got syphilis also can, mother got HIV, all sort of reason lah they admit. Okay, alright. Then admitted for how long, ventilated for how long. Okay, that you want to know. Ventilation, invasive ventilation for 5 days, 6 days. Then we are off to BiPAP, then we are off to CPAP, then we are off to oxygen. Berapa lama oxygen? That's until that kind of level lah, especially in patient premature babies lah. You want to know this ventilation history. Yang lain tu, kalau ventilated 1 day 2 days, most likely we don't really want to follow up lah. Kalau ventilated lama, you want to follow them up for growth and development, all those things lah important. Okay lah. Then postnatal, other than that, discharge, ada jaundice or not lah, how high is the jaundice, need phototherapy or need exchange transfusion. Those are kind of history lah. And then any prolonged jaundice or not. Okay, if you know about the GCPD pain status, thyroid pain status, cortisation, they are even better. That about birth history lah. Sounds simple lah. There's a lot of birth history you need to take under birth history alone. Okay, next.
Vaccination is up to age, and no additional vaccination. Okay.
So vaccination up to age. What else? So are they then taking vaccination up to age it's best to basically ask lah what was the last vaccination taken, and then what other additional vaccine has been given. Okay, then how you want to know a patient really take the vaccination? How do you want to confirm?
Ask the last vaccine.
Sorry?
Ask the last vaccine taken on which
Okay,
age.
some more. What is the easiest way to confirm?
Take the pink book.
Yeah, take the pin book lah. Take the pin book and see lah book or not. If
Parents didn't bring the
if they didn't bring, you ask them to bring. If patient admitted to the ward, you ask them to bring. Then you confirm. Kalau tak nak bawa. Even despite you asking multiple times, you know lah suspicious. Taken or not. Okay? Right. And then one more thing, you have to remember lah, hafal your vaccination schedule lah. Okay, then you know lah.
The pneumococcal mandatory pneumococcal vaccination introduced which year?
It should be around 2021, 2022. I can't remember. I also can't remember
because
exactly.
got one patient didn't take the pneumococcal, so I wondering.
Sometimes they miss lah. Sometimes they don't miss lah. I think there is a transition. 5 years old, maybe they not really compulsory yet. I can't remember. I think it's around 2020. I can't remember exactly also. I think it's around there lah. But even that 2020 pun only certain month onwards. Even born 2020 pun they still like miss the boat also lah. Could be that one also lah. Then the additional vaccine. What are the additional vaccine?
Hepatitis,
A,
B, influenza vaccine.
Sama?
Meningococcal vaccine.
Okay, sama. Meningococcal, influenza, hepatitis A. Okay, and lagi?
A, B, hepatitis B vaccine.
B is part of your
yeah.
Okay, H kot lah. It's one additional vaccine. Sama?
That's all I can think.
Oral vaccination?
Polio.
No polio already injection. There's one oral vaccine, but it's under recommended vaccine. Rotavirus lah. Oral vaccine. Okay, what else?
RSV vaccine.
RSV is not vaccine, it's antibody, it's friend. That's why nama dia Pavlizumab.
Very expensive.
Very expensive. All the map at the back tu like Adalimumab, Tocilizumab, it's all antibodies one. It's not vaccine. Okay? Apa lagi? JE? Japanese encephalitis also got vaccine. Only compulsory in Sarawak. Not in Malaysia. Malaysia also can give, no? Okay. What else? Habis already. Chickenpox, don't forget. Chickenpox vaccine. Very commonly seen. So, you don't want your children, your siblings to get chickenpox, get the vaccination lah. Kalau you adult never kena chickenpox also, it's recommended to get lah. Sometimes because when adult kena chickenpox, it's even worse compared when you get chickenpox during your childhood. Even because complication is even higher chickenpox in adult compared chickenpox during childhood. Our ex-prime minister yang kena penjara tu kena chickenpox during adulthood lah, sampai masuk hospital. Don't know for what reason lah masuk hospital. Could be pneumonitis lah. Okay. Okay, that's about vaccination. Next.
Developmental, I asked about the school lah, but he was a slow learner and does not participate.
Patient how old already?
13 years old.
Patient 13. Anyone school going age, you need to ask about school performance and all that lah. You don't really dwell into the first 6 years punya development history, but those yang preschool and below, you still need to ask the development, gross motor, fine motor and all that lah. Okay, so 13 years old.
He's a slow learner according to the father.
So what learning this problem? Slow learner only lah.
Slow learner.
Okay, but sometimes you need to know lah, is it learning difficulties? A lot of learning difficulties. Slow learner could be related to the IQ lah. Okay, sometimes IQ also might be normal or borderline, but somehow learning got issue. Not much specific learning problem. It could be dyscalculia, dyslexia, all those learning specific problem lah. Like could be autism, could be ADHD, but it doesn't fulfill all the other criteria, then they just put slow learner lah. Or sometimes if IQ is low, then you put intellectual disabilities.
Because this one with like the father mentioned about slow learner need to refer because this patient
Need,
not
but sometimes it's fine not slow learner probably because of underlying chronic disease. Because when you are regularly admitted, your school interrupted, your daily activity interrupted, you're not really stimulated as other children. Because your environment is always hospital. Then how to learn properly? So that slow learning could be partly due to the chronic disease lah. But you still have to basically check up properly lah. Is it truly slow learning? Is it intellectual disabilities? Or is it specific learning disorders lah? As I mentioned earlier. Okay, alright, next.
Activity level is not very active because of the underlying disease.
Okay.
Reduced effort tolerance. So family history and social history have been asked in details.
So you still need to ask, as I said, no shortcut lah for you all. Medical student, no shortcut. That's the way, only thing you learn. Because you're not going to be pediatrics. You're going to be general doctors first. So I have to ask the basic thing first lah. Family history, what you want to know?
The father age, the patient, and also any underlying disease.
Okay, next.
The mother and also the first degree family.
Basically three generation lah.
Three generation including the
grandmother lah. Grandmother, parent, and patient. Okay. Then any underlying problem with the siblings, underlying problem with the parents, underlying problem with the grandparents lah. Alright.
The parents siblings need
Me also lah, same also lah. You same as others lah.
Okay.
Especially those related. If you taking the problem related to underlying brain problem lah. It could be epilepsy, it could be developmental delay, anything chief complaint related to the brain. Lagi more apparent your family history you need to get lah, because a lot of things is genetic. Asthma also important lah, because asthma also runs in the family. But you need to be more detailed in terms of genetic problem, developmental problem. You want to know specific problem lah, like any developmental delay in the family, any specific learning problem in the family. More so you want to know the consanguinity lah in between parents. What is consanguinity?
The mother or father married their siblings.
Not siblings, the worst consanguineous there is lah. So even second cousin, third cousin is still consanguineous lah. Because more consanguineous they are, more likely for genetic problem. Yes, more likely for it to be genetic problem lah. Okay, alright. Genetic and metabolic lah, not just genetic, metabolic also. Okay. What else? Family history. Okay, then social.
Social ask about where they live, what is the living environment like, what is the housing type, any smoker in the home, and who take care of the child usually, and also the caretaker, main caretaker.
Okay, then basically you want to know the main caretaker, who's the taking care of the child. Is it the babysitter, is it the parent? Because both parents are working, and most likely the babysitter or the send to daycare lah. Those yang recurrently ill tu, most likely they go to daycare lah, because more crowded the places, more likely they exposed to certain bugs lah, more germs, more infection lah. Okay, but on top of it, you want to know the financial status lah, because a lot of management will be hindered by financial problem. You want to do this, send this, send that, so many things you want to do, but it involve money. Then financial status might hinder it lah. If patient able to pay, then that's good. You can proceed with your plan. But patient got issue, patient need prolonged admission, no money to pay, like government hospital, maybe no issue lah. But patient in MMC, if you government servant, also no issue. They still charge as same as KKM. But nation citizen in university hospital charge everything. But even though the charge is like 10 ringgit per blood, but if you taking it regularly, it accumulated lah. Over time, it become a lot. In the end, the bills end up maybe in the thousands punya range. Some people gaji pun berapa je. So you might want medical social worker, you might want certain NGO to help and all that lah. In the end, financial status is very important, one thing. Another thing, the family punya dynamics lah. If patient very poor social background, only mother is around, parent, father not in the picture, not much family support, lagi susah. Mother kena kerja, tak ada orang nak datang follow up, siapa nak bawa follow up, siapa nak jaga budak-budak ni kat rumah. You bagi plan patient on CPAP ke, patient nak kena buat certain thing kat rumah, GTube bagi feeding, rice tube feeding apa semua, siapa nak buat. All these thing you have to fikir lah. So the good family support easier to manage lah, but most of the time we are dealing with a lot of patients with poor social background, means like single parent, broken families, all those things lah, very poor financial background. So a lot of things will kacau your management. Even though you plan so nicely, all these things easily manage with this, but somehow tak datang follow up, tak makan ubat, duit tak ada duit nak, all those things lah. So that's why very important to know. You don't have to really ask about the what dia orang kerja apa lah. Yeah, of course lah, you have to ask to know lah, but basically just get the estimate lah how much they earn per month. Sometimes they don't have specific income per month, some don't have even don't have permanent job. Okay.
Feeding history, the morning eat what, afternoon dinner eat what, anything like.
Also diet history next. I forgot about diet.
So diet and feeding is not the same.
Diet feeding history same lah. If you ask about diet, basically you want to know about the feeding pattern lah, and then including the diet lah.
Including the diet, like morning they eat what usually, afternoon they lunch they take what, and dinner they take any snacks in between, any picky.
Before you go into it, what you want to know first? The diet, solid diet. You want to know about
the type of
the meat first lah. Once start breastfeeding, how long breastfeeding first?
The exclusive breastfeeding until which formula milk or breast milk.
Weaning at how old? Okay, support. So diet start with breastfeeding first lah. Berapa lama dia breastfeed? Okay, then breastfeed. Then kalau tak breastfeed, berapa lama? Why tak breastfeed? Is it susu tak cukup? Is it working issues? Sometimes they 2 months, 3 months they started to work already. Then they express. Then they taking breast milk still lah, but it's express breast milk, EBM. It's different compared to breastfeeding on demand. Tak sama. Breastfeeding on demand mean on demand baby cry, baby want, baby suck, then baby stop. You don't know how much baby takes. EBM, you give fixed amount. You start 16 mil, dia dapat lah 16 mil every 3 hours, something like that. Okay, then they started weaning at what age lah? Usually 6 months. Some may start earlier, some may start a bit late. Depends on the issue lah. Okay, then started to know about the diet lah. Makan apa tu, now current diet, makan 2-3 times a day. Is it 2 times a day only? Still taking meat or not? All those things lah. Then kalau patient yang underweight, you want to know lah, kenapa dia under. As I probably mentioned this before lah. Patient yang still taking milk, diluted or not the milk. Okay, diluted milk, you know lah, not enough calories. Okay, patient yang overweight, you want to know lah, how much milk they're still taking, even though they're not supposed to take anymore lah. Okay, then you advise them to dilute the milk lah, solely because of the reason to wean off the milk after 1 week, 2 weeks, 3 weeks, 3 weeks after that. Okay, then you want to know lah, how much you intake every 6 times per day. By right, children should take 3 times main meal, maybe in between snacking about 2 to 3 times. Those yang under, you probably want to take more, but you advise them to snack a bit more as well lah. But snack the healthy snacking lah, rather than the unhealthy snack. Healthy snacking included your plus your susu, plus your buah and all that lah. Okay. Apa lagi? I think about the diet lah, roughly.